So what are the main reasons that patients want to have presbyopia correction surgery? Number one is frustration. That's the word that I hear time and again in the clinic, and it's the on-off. And the big patient group here are the patients who've never needed spectacles. People like me, who were lucky enough to enjoy great distance vision, and in their 20s and 30s could enjoy that seamless range of focus that accommodation gives us, that ability to shift focus from distance to near and back out again in just under a second. So patients like me, when the presbyopia hits, the distance vision remains excellent, so it's all too easy to head out the house in a hurry and forget to pick up the reading specs, and then arrive at work for that important meeting and find they can't see anything up close. They can't read, they can't keep up with the paperwork. If they do remember the specs, it's the frustration of the on-off. They're on, they can see here, but they can't read the facial expressions of the people they're having a meeting with. And then it's the limitation of activities. So I might look after someone who really enjoys golf, and they enjoy their distance vision, and if distance vision is still good, they can still see where they've hit the ball, but they can't read the scorecard. And so again, they have to remember to take their reading specs with them, and it's compromised their enjoyment of an important part of their life. Musicians, they can see the conductor, but they can't read the music, and so they then have to adjust with varifocals. And not everyone finds varifocals easy. A lot of people find, and these are often spectacle wearers who've been wearing specs to correct their myopia for many years, and then the presbyopia comes along and they have to put varifocals on in order to see up close as well as distance, and then they try and walk downstairs and everything comes up at them at a funny angle, and they feel seasick, and optometrists have to counsel their patients and encourage them to adapt to it. But it is a process of adaptation, and not everyone can do it. Some people really struggle and find they have to go to having 2 pairs of specs, or even 3 pairs of specs, one for distance, and I've got one for reading music on the computer, and I have another one for reading. And so some patients will come to my clinic with literally a collection of spectacles that they require in order to function. So I think the key reasons that I see people are frustration, and the fact that they have started to have to compromise their quality of life. It's also, it feels a bit aging, and I know people say maybe we shouldn't, or we should not fight the aging process, but it's affecting me now. I'm starting to be aware of my own presbyopia. It's got a few years to run, but I already know that I'm going to have something done about it. In fact, I'm going to have presby on LASIK in order to restore that function, because I don't want to let go of the function I've enjoyed, and I don't want to stop doing all the things I'm enjoying. And it is nice to feel young.